Okay, so welcome to Eat, Move, Think, the show about optimal wellness brought to you by Medcan.
Wow. Do it again.
Oh, I was practicing. Okay, ready?
Welcome
to Eat, Move, Think,
the show about
optimal
wellness brought to you by
Medcan.
Yeah, this is extremely good. Thank you.
Okay, Chris, you recall that in our preparation for this episode, we read a particular article, and the article was called The Scoop on Poop.
Yes, it was. I recall this.
It got quite a laugh among us.
Well, yes, because we're immature, basically. Our senses of humor is immature, and we laugh at that sort of thing.
But it also is wonderful wordplay and rhyming, which we admire.
We wish that's what we could have called this episode, because that's really what this episode is.
Yeah, it's all about your gastrointestinal health, your digestion,
nutrition. It's about how what goes into you affects what comes out of you.
And what it is that comes out of you means for your overall health and wellness. I'm Jasmine Ratch.
I'm Chris Shulgin. We're the producers of Eat, Move, Think.
So in this episode, our Eat host, Leslie Beck, is joined by Dr. Bharat Markandey. He is a gastroenterologist at Medcan and at University Health Network. And we should probably define what a gastroenterologist is.
Done. Okay, here it is. A gastroenterologist is a specialist with expertise in the disorders and diseases that affect the digestive system, all the way from the gastrointestinal tract to the pancreas, liver, bile ducts, and gallbladder. But here, we're mostly interested in the gut. Small intestine, large intestine, colon.
So without further ado, I think we should get right into Medcan's comprehensive guide to gastrointestinal health.
Give us the scoop.
Here's Leslie Beck in conversation with Dr. Bharat Markandey.
Welcome to the Eat, Move, Think podcast, Dr. Markandey. I think this is going to be a really interesting episode. You know, gut health is a really popular topic today, and there's lots of conversations about it on social media. Why do you think it's become such a popular topic?
I think it's because right now scientists are researching and determining what is sort of defined as optimal gut health, which is not exactly completely clear yet. And we're trying to map out the genome that makes up the gut microbiome and what is a good bacteria, what is bad bacteria. And all of this will allow us to reassess sort of the effectiveness and or the potential consequences of current therapies, such as antibiotics that we use for various conditions. So outside of the world of medicine, there's lots of development in promoting gut health. And from a client or consumer perspective, there are many new products or diets that are being advertised. And the real question is, what is the evidence or benefit behind all of this? And what should we be recommending for our patients?
Yeah, so talk to us specifically about why taking care of our gut health is so important for our overall health, beyond, of course, its important role in digesting food. Give us a few concrete examples on perhaps what listeners out there may not think about, that the gut is connected to these different health aspects.
Yeah, so the gastrointestinal tract, which is essentially the tract from the mouth to all the way to the bottom end, is home to trillions of microbes and microorganisms, which make up the gut microbiome. And this can influence your overall health. So this includes your immune system, your brain and mental health, inflammation, which can lead to autoimmune disorders, and also general sort of gut health being like appetite and satiety, so how full you feel.
So the microbiome is very important. And certainly we know that eating a healthy diet is really important for maintaining a diverse and rich community of microbes in our gut. I'm asked this every day, actually. And the points that I make with clients are, I think, in terms of building a diverse, which we think today, a diverse microbiome is a healthy microbiome. We're not 100% sure on that. But, I tell people, our clients, to make a point of eating plenty of fiber-rich foods, those fermentable fibers in whole grains, vegetables, fruits, nuts, and seeds. They're digested by gut bacteria, so we need to feed our gut bacteria as well, and that creates compounds called short-chain fatty acids, which provide fuel for intestinal cells. So fiber is really important, a wide variety of plant foods. The American Gut Project, which is the largest microbiome study to date, they did a study and they found that people who eat more than 30 different types of plants each week have a greater gut microbiome diversity than those who eat 10 or fewer. I've tried to track this myself. Even though if you have a diet that's very high in plant foods, that's tricky to do. So lots of fiber, lots of plant foods. And the other thing I often discussed with clients is including fermented foods in their daily diet as well. There was a really interesting study published in 2021 from the Stanford School of Medicine. The researchers actually showed in this experiment that a daily intake of fermented foods did enrich microbiome diversity and actually lowered about 19, I believe, inflammatory proteins in the bloodstream. So I think diet is something really important to talk about when we talk about microbiome.
And Leslie, I think it's particularly important that we reduce the amount of processed and high sugar and high fat foods that we eat, as this can lead to better gut health.
No, you're absolutely right. It's so important to prioritize, like you say, whole foods and really minimize our intake of those ultra processed foods that are lacking fiber, contain unhealthy fats. Studies certainly do show that a very healthy dietary pattern, like you've just described, is linked with a more diverse microbiome. So that's a great reminder. Can I ask you on that topic, do you recommend that healthy people take a daily probiotic supplement?
That's a really good question. And certainly I get asked this a lot. I think, first of all, it's important to know what probiotics are. And those are foods or supplements that contain live microorganisms intended to maintain or improve the good gut bacteria, or what we call the normal microflora in the body. And the health benefits of probiotics and prebiotics are not conclusively proved. So it's difficult to universally recommend this for everyone. The good thing is, however, side effects are rare, and most healthy adults can safely add foods that contain probiotics to their diets. But future research may lead to advanced probiotics with greater potential to improve health. Now, in certain conditions, there's also some evidence, such as inflammatory bowel disease, for example, or irritable bowel syndrome, where probiotics can be particularly more helpful. But overall, I would say if you're considering taking supplements, you should check with your doctor, make sure it's right for you. And as a general rule, it is not a formal recommendation that everyone should be on probiotics for a healthy, asymptomatic individual otherwise.
Yeah, and where I come from on that is that, unless it's a very specific strain of probiotic that's been proven to help with a certain condition, like treating, antibiotic-associated diarrhea or traveler's diarrhea, or reducing IBS symptoms, for example, I typically don't recommend that healthy people take a one-a-day probiotic. I read a really interesting article in the Washington Post not too long ago that suggested it's possible that taking a concentrated amount of just a few strains of probiotic bacteria, whether those are lactobacillus or bifidobacteria, could possibly even upset the balance of your gut. So in other words, you might not only be crowding out some of the bad microbes that you've mentioned earlier, but you could potentially also be crowding out some of the good ones that you want there. And I think it is possible that probiotic supplements have different effects in different people depending on their gut microbiome. So, like I said earlier, I encourage people to consume fermented foods, which are basically a rich source of naturally occurring probiotics. So I'm kind of changing my tune. So generally, how does someone out there that's listening to us today, how do they know if they have a healthy gut? How can you tell?
Overall, I think if you don't have any GI symptoms, you're probably safe. And so that means you don't have any abdominal pain or discomfort generally after eating. You have regular sort of well-formed tubular bowel movements. If you feel symptoms like bloating or gas, heartburn, constipation, diarrhea, that may be a sign that your gut may not be working appropriately or optimally. And so the color, frequency, volume, and consistency of your stool are all important things to consider, as well as when determining if your gut is functioning optimally.
So let's talk about bowel movements for a moment. So what is considered normal? What is the definition of constipation?
Defining normal in this area is not easy because there is a huge variation. But what has been studied and what has been defined as being within the normal parameters is someone who's having an ideal stool is medium colored brown, and it's long, tubular in structure, it's smooth and soft, which passes easily from the body with little straining or effort. So healthy individuals typically have bowel movements anywhere between 3 per day and 3 per week. So more than 3 per day is sometimes associated with diarrhea, and fewer than 3 per week typically suggests constipation. So these are what we would consider normal, healthy patterns. But as we do know in sort of practical day-to-day practice, there are lots of variations in this, and individuals don't necessarily fit into these particular categories and may have a healthy or normal gut nonetheless.
So in general, anywhere from 3 bowel movements a week to 3 a day is considered normal. Okay.
Exactly. Yeah.
So certainly getting plenty of fiber and drinking enough water every day. We hear about these strategies all the time. They are important to prevent and treat constipation. And psyllium fibers have been shown in studies to be effective too. What non-diet strategies are really important to prevent constipation?
When we think of constipation, we should think of, fecal material moving appropriately and effectively through the GI tract. So how do we promote that from happening? So I think remaining physically active is very important. So engaging in regular exercise, some type of program would be very helpful. And we know this because patients who are unfortunately bedbound or physically inactive definitely have lots of issues with constipation, and then can have things called what we call ileus, or where the gut doesn't move as well. And we need to stay physically active to promote the propulsion of sort of fecal material throughout the GI tract. And trying to manage stress is also a very important thing to consider, because a lot of our gut health relates to how our brain is functioning or communicating with the gut. So if we are stressed and our brain is stressed, then those communications or those neurons which affect the enteric nervous system, which is the nervous system controlling the gut, is impaired. So that can certainly lead to issues with constipation or diarrhea or other GI symptoms. And simple things like not ignoring the urge to pass stool, trying to create a regular schedule for bowel movements, especially after a meal, are very important things to consider. And as you mentioned, drinking enough water or psyllium-based products are out there to help. Supplementing with fiber products such as Metamucil is sometimes what we recommend. And when we do recommend that, we sometimes say starting with 1 teaspoon a nighttime for about 2 weeks. And if patients tolerate this, they can make their way up to a heaping tablespoon. But I would still say if you have GI symptom issues, you should consult your doctor first. And if that recommendation is made, then you can take Metamucil to help promote a healthy gut and prevent any GI symptoms.
Okay.
Leslie, what are the best food sources of fiber you recommend to patients?
I definitely recommend that clients reach for more insoluble fiber, which is different than the type of fiber in psyllium. But, foods like wheat bran, whole grains, nuts, many different fruits and vegetables, they contain mostly insoluble fiber. And that's the type of fiber that retains water. It adds bulk to stool, helping it pass more quickly through the intestinal tract. And often with clients, I find that they're successful at treating constipation by adding a concentrated source of insoluble fiber to their diet, such as wheat bran, whether that's in the form of raw wheat bran cereal, that kind of thing. But fruits and vegetables, so apples, berries, figs, kiwi are high in insoluble fiber. And actually, kiwi has been shown in studies to help treat constipation as well. Bell peppers, carrots, green beans, parsnips, green peas are good sources as well. And other decent sources of insoluble fiber, whole wheat pasta, 4 to 6 grams per cup. Farro is a whole grain that has 10 grams of fiber per cup. Quinoa, whole grain breads. So definitely in their diet, I get people to focus on insoluble fiber.
Great. That's great.
Let's talk about laxatives for a minute. So which types do you recommend? And I guess the other question is, I know there are certain types that your body can become dependent upon, correct?
Yeah. So there are many different types of laxatives out there, and they work in different ways. So I can give you some examples. So one of the types is called an osmotic laxative. So that can be, for example, milk of magnesia or Miralax or Restorelax. And that basically draws water into the colon to allow the easier passage of stool. Then there are bulk formers, as you mentioned, Benefiber or Metamucil, and these absorb water to form soft, bulky stool, promoting normal contractions of the intestinal muscles. Then there are stool softeners, such as Colace, and this adds moisture to stool to soften the stool, allowing strain-free bowel movements. There are stimulant laxatives out there, such as Senecot, which trigger actually rhythmic contractions of the intestinal muscles to eliminate stool. And then there's also other types of administration, such as rectal suppositories, such as Dulcolax, for example, which also trigger rhythmic contractions and soften stool. As you can imagine, if we are using this inappropriately, this can result in side effects, whether that's bloating, cramping, diarrhea, abdominal pain, for example, and sometimes even electrolyte imbalances, which can also cause other downstream side effects. So there are risks to using them if you're not using them appropriately or not as prescribed. And the risk can include interactions with medication. So it's important to ensure that the other medications you're taking do not interact negatively. It can also complicate other conditions. For example, laxatives can be dangerous if the constipation is caused by a serious condition such as a bowel obstruction, which if you're taking a laxative which is promoting intestinal contractions against a bowel obstruction, that can result in complications such as a perforation, which is very serious. And also younger children or pregnant women should be cautious as well and should consult their doctors before using laxatives. And your last question was about dependency. Of course, if your gut becomes dependent on them and gains a tolerance, you may end up requiring increasing dosages of laxatives to achieve the same end result as well. I would say overall, PEG-based laxatives such as Restore-Lax are often recommended and overall safe and tend to be well tolerated with a good safety profile, but once again, should be recommended by a doctor.
So is it true that if you are using one of the stimulant laxatives, like let's say Senecot or another one, and if you're using that on an ongoing long-term basis, if you stop using it, can you have a lazy bowel after that?
A good question. And I think it once again comes back to the fact that your gut can become dependent on it. I'm not sure if it'll totally make it lazy, but if you actually do a colonoscopy in someone who takes a laxative for a very long time, for example, Senecot, you can actually get a discoloration of the inside lining of the colon. We call this melanosis coli. You can get this in different parts of the GI tract. Although in itself it's not particularly dangerous, but we do see effects of the laxatives, especially chronic use, even when we do colonoscopies, for example. So there is a good, use for them in chronic constipation or other constipating functional GI disorders, but it should be recommended and should not be used excessively or inappropriately for sure.
So let's move on to the consistency of our stool, which you discussed briefly earlier. Talk to us about the Bristol chart. What is that?
Yeah, so the Bristol Stool Chart is an internationally recognized sort of model on which we can grade the texture and shape of an individual stool. It's essentially a scale-based system, and it starts from 1 and goes all the way to 7, and it rates your stool on how liquid or solid it is. So for instance, small hard lumps that are difficult to pass, such as small pebbles, would be classified as a 1, and entirely liquid stool would be classified as a 7. So on this scale, 1 to 2 could signify constipation, 3 to 5 could be overall considered to be a healthy stool, and 6 to 7 could point towards diarrhea. This is particularly important because we can provides us some comparison with healthy, normal individuals, and also it can help us guide how effective our therapeutic strategies are. So if someone comes in with severe diarrhea, they start with a Bristol stool score of 6 or 7, and we initiate some form of therapy. If they're making their way up that ladder towards a 5 or a 4, that means that our therapy is working.
Okay, that's interesting. What does the color of our stool mean when it comes to whether or not our gut is healthy?
Yeah, and I think color is very important, and there's many things that can affect the color of our stool. Black stool, which can occur, and this is very serious if it occurs, it is important to see your doctor, as this could be a sign of internal GI bleeding from a higher source in the upper GI tract, especially if this is accompanied by a foul smell and it is black and tarry, that can point towards internal bleeding. So it should never be taken lightly. However, there are also other benign causes of black stool, and this could include ingesting things like Pepto-Bismol or other bismuth subsalicylate products, which can also turn other things black, such as your tongue. Iron supplements.
Right, iron supplements, yeah.
Yeah, darken the color of your stool. So often when we prep patients for colonoscopies, for example, we ask them to stop iron supplements for 7 days as it can discolor things inside as well. Black licorice or blueberries or things that have artificial colorings can also certainly affect the color and make things darker or black. So other things to consider are also red or maroon stool. And once again, these are very important to identify because if you are bleeding in the lower portion of the digestive tract, then this could be causing bright red blood stool. And this can result from inflammatory bowel disease, diverticulitis, hemorrhoids, fissures, and even cancers. So that's why they say when you see red, you should go get checked out. However, a red stool might be unrelated to bleeding as well if you're consuming large amounts of food with red coloring, such as cakes or cereals or tomato-based products, for example, which can also...
Or even beets.
Beets, yeah, that's a common one as well. Orange stool is another one. And if you consume carrots, which have a lot of beta-carotene in it, for example, or sweet potato and some herbs, this can also make your stool orange, but not necessarily pathogenic or problematic. It's just changing the color there. Now, if you have pale stool or gray stool, this can certainly mean you may have a liver or gallbladder issue. And if they're particularly associated with dark urine or pale stools, then you should certainly see your physician. And if you have a bright yellow diarrhea, this can signify a intestinal infection called Giardia. And that's also something to look out for. Now, green stool most often is resulting from ingesting large quantity of green foods, such as green leafy vegetables or green coloring, which is added. And green stool overall, not necessarily problematic, but as I mentioned, could be related to what you're eating. Finally, blue stool, which I personally have not seen. If you're eating a lot of blue foods, such as blueberries or beverages with blue food coloring, such as grape pop, can also turn your stool into this color. So as you can see, it can turn various different colors and means various different things. I think overall, the message is that brown is typically healthy.
Right.
Black, red, or maroon need to be looked into, and also pale or gray. But overall, if there's any significant change from your normal baseline, that is what warrants a checkup with the doctor and make sure everything is okay.
Okay. So let's move on to GERD, or gastroesophageal reflux, which affects 40% of North Americans. What causes GERD in the first place? My first question. And secondly, what are the possible symptoms? Because heartburn isn't always among them, correct?
Yeah. So signs and symptoms of GERD can include heartburn, as you said, but not always present. This heartburn can be more pronounced when you're eating late at night or while you're laying down. As you can imagine, the angles through which the food content passes back is more lax. And backwash or regurgitation of food or sour liquid is another symptom. Upper abdominal pain or chest pain can be caused by acid reflux. Trouble swallowing, what we call dysphagia, so the feeling of food getting stuck and not going down, could be a sign of acid reflux. And a sensation of a lump in your throat can also be related to this. If you have nighttime acid reflux, you might also experience an ongoing cough or a hoarse voice because of the inflammation of the vocal cords, which is causing laryngitis, or new or worsening asthma. So one of the most common causes of cough or chronic cough, we always look into whether or not this is GERD. And there are many conditions that can increase your risk of GERD. So this can include obesity or being overweight, or having a hiatal hernia where every time you breathe in, a part of your stomach goes into your chest. Pregnancy, connective tissue disorders, or delayed emptying of the stomach can certainly cause GERD. Right. And there are many factors that can aggravate acid reflux, which include, for example, smoking, eating large meals or eating late at night, eating certain foods such as fatty or fried foods or spicy foods, which are commonly reported, or drinking certain beverages such as alcohol or coffee. And lastly, taking certain medications such as anti-inflammatory medications such as aspirin.
Yeah, those are good tips when it comes to diet. I always recommend clients, they eat smaller meals more often to help reduce acid reflux into the esophagus. I tell clients to eat at least 3 hours before bedtime to allow time for food to empty from the stomach. And, it can take up to 4 hours for a solid meal to move out of the stomach. Like you said, limit fatty foods, whether that's, fried foods or high-fat baked goods, ice cream, sausage, chips. We know that fatty foods can worsen reflux symptoms by causing the esophageal sphincter, that valve from the esophagus into the stomach, to relax so that you're more likely to experience that. And we talked about psyllium supplements for constipation earlier, but there also has been some research that taking psyllium 3 times a day, one study found that it reduced heartburn and reflux episodes in people. So that's something else some people might try. And of course, losing excess weight can significantly reduce GERD symptoms because, that extra weight around the middle, as we know, creates abdominal pressure that can disrupt that lower esophageal sphincter and just promotes more reflux. Okay, so let's talk really briefly about irritable bowel syndrome, or IBS. How common is it in your practice, and how do you diagnose it?
Yeah, so irritable bowel syndrome, or IBS, is very common and is a type of functional gastrointestinal disorder. These conditions are also called disorders of the gut-brain interaction, as I previously alluded to, and have to do with problems in how your gut and brain work together, or how they communicate or miscommunicate with each other. So these problems cause your digestive tract to be very sensitive. They also change how your bowel muscles contract, and this results in abdominal pain or diarrhea or constipation. So often when we talk about irritable bowel syndrome, we can divide into 3 different categories. So you can have constipation predominant, you can have diarrhea predominant, or a mixed subtype. So where patients can have issues with diarrhea or issues with constipation. So it's an extremely common condition. It's probably one of the most common diseases that gastroenterologists diagnose, and certainly one of the most common things I see in my practice as well. And in terms of diagnosis, when I was training, it used to be thought that you need to rule everything out first and then give the label of IBS. But more and more, we're giving the diagnosis up front based on a very typical history and pattern that is described. And the diagnosis is based on the presence of specific symptoms on the history. And there are many international research groups that have developed, defined the symptoms of IBS and have established criteria, what we call the Rome criteria. And these Rome criteria allow us to define the patient as being IBS, constipation predominant, or diarrhea predominant, or mixed. And this helps us use this label appropriately. And there are currently no lab tests or imaging tests that diagnose IBS in itself, but a trained and experienced physician can distinguish the classic symptoms of IBS from red flag symptoms such as anemia, weight loss, bleeding, which would warrant further investigations. And based on the risk factor profile of the patient, that may be age or their family history, may lead to further investigations such as a colonoscopy, for example, to ensure we have ruled out any other sinister conditions. Leslie, are there any diet modifications that help patients manage their irritable bowel syndrome?
Yeah, well, you mentioned that constipation dominant, diarrhea dominant IBS, and then alternating. What I actually see more often than that is clients coming in complaining about bloating, gas, visible abdominal extension, and of course, sometimes loose stools as well, or constipation, but the really uncomfortable bloating and gas distension that interrupts their day. So one approach that we use at Medcan is a low FODMAP diet. And I'm sure you're familiar with this, of course. That's a diagnostic approach to identify which particular fermentable carbohydrates are causing these symptoms. So a low FODMAP diet is not a forever diet. It's a short-term elimination diet, and FODMAP is an acronym for 6 different fermentable carbohydrates that are absorbed poorly in the small intestine. So they make their way to the colon, and along the way they can pull in water, causing loose stools. Once they get to the large intestine, bacteria that live there ferment them, and that can lead to gas, bloating, abdominal pain, etc. So the approach we use for a short period of time, we remove foods that are high in these FODMAPs. For example, lactose is one, fructose is another. And normally people feel markedly better in a very short period of time. And then there is sort of a reintroduction and a challenge phase. So very methodically, we add back in 1 FODMAP per week. There's a test food, there's a correct portion size. So the goal at the end of the day is to determine, number 1, which FODMAPs are bothering people, and number 2, in what amounts can they tolerate, so that they don't have to be afraid of eating, for example, a small amount of chickpeas or that kind of thing. And I think at the end of the day, what I love about working with this program at Medcan and our clients is that people, at the end of the day, they just feel that they are now in control of their IBS, and they know what bothers them and what doesn't, and they get back to sort of a more well-rounded diet. So definitely that is one approach, that dietary modifications that we use to help people manage their IBS.
Yeah, and Stanford University, as well as the Canadian Digestive Health Foundation, both have really good resources on foods that are low in FODMAPs or high in FODMAPs and what to avoid.
Yeah, that's right. And I think it's really important for people to understand that this isn't a diet that you follow forever. It's really important to work with someone to reintroduce properly, methodically, so that we find out the information that we want to find out. Okay, I have one last question for you. So as a gastroenterologist, tell us how you take care of your own gut health.
Thank you. That's a great question. And I think there's a lot of things to consider here. And what I try to do myself is I try my best to lower my stress level. So whether that's going for a walk every day or spending time with friends and family or meditating, for example, I try my best to get enough sleep. And, of course, at times our schedule doesn't always allow that. But if I can try myself to prioritize and get at least 7-8 hours of uninterrupted sleep per night, really helps me function well. It makes me feel better. And I certainly do see the impacts of that on my gut health. If I don't sleep well enough, or if I'm up overnight on call, for example, I definitely do not feel as comfortable. So I definitely try and prioritize my sleep. I also try and chew and eat my meals very slowly and carefully to prevent myself from making poor food choices and to ensure that I'm digesting my food appropriately. And the main thing I would say is also staying hydrated. So I love to drink lots of water. I try and drink at least 2 to 3 liters of water myself a day to stay healthy and hydrated and prevent poor bacteria in my gut, and it makes me feel better myself.
Yeah, those are great strategies for listeners. Thank you for sharing those with us. And it's a great place to wrap up today as well. So I want to thank you so much for joining me today, Dr. Markandey. This has been a really great sort of all things gut health conversation, and I really appreciate your expertise. Thank you so much.
Leslie, thank you so much for having me. This was a wonderful conversation and hopefully very helpful for our listeners and our patients. And this has really been, a great review of all important things related to gut health.
That was Leslie Beck, Medcan's Director of Food and Nutrition, in conversation with Medcan and UHN gastroenterologist Dr. Bharat Markandey. You can book a consultation with a Medcan dietitian or gastroenterologist by emailing bookingteam@medcan.com. Follow Medcan on Twitter and Instagram at MedcanLiveWell, and follow Leslie Beck on Twitter at LeslieBeckRD. We'll post episode highlights and other links you can visit on our website, eatmovethinkpodcast.com. Say hello and send us a tip or a suggestion by emailing us at info@eatmovethinkpodcast.com, but no pictures for this episode, please. Eat, Move, Think is produced by Ghost Bureau. I'm managing producer Jasmine Ratch. Social media and strategy support is from Chantel Gertin, Andrew Imex, and Emily Bozick. Christopher Shulgin is executive producer. We will be back soon with another episode examining the latest in health and wellness. This podcast episode is intended to provide general information about health and wellness only and is not designed or intended to constitute or be used as a substitute for medical advice, treatment, or diagnosis. You should always talk to your Medcan healthcare provider for individual medical advice, diagnosis, and treatment, including your specific health and wellness needs. This podcast is based on the information available at the time of preparation and is only accurate and current as of that date. Source information and recommendations are subject to change based on scientific evidence as it evolves over time. Medcan is not responsible for future changes or updates to the information and recommendations and assumes no obligation to update based on future developments. Reference to or mention of specific treatments or therapies does not constitute or imply a recommendation or endorsement. The links provided within the associated document are to assist the reader with any specific information highlighted. Any third-party links are not endorsed by Medcan.